Musculoskeletal review. Synovial joints offer more movement than fibrous, bony, or cartilaginous joints. Synovial joints are multiaxial, monoaxial, and biaxial. Multiaxial synovial joints have 3 or more planes of movement. Biaxial synovial joints have 2 planes of movement, and monoaxial synovial joints have 1 plane of movement. There are 6 types of synovial joints: ball and socket joints, condylar, saddle, plane, hinge, and pivot. Ball and socket joints allow for the largest range of motion in any of the synovial joints. Ball and socket are the only multiaxial joints in the body. In a ball and socket joint, one bone contains a smooth, round head, such as the head of the femur or humerus, that connects into the socket of the articulating bone, the glenoid cavity of the scapula, or the acetabulum of the hip bone. Condylar joints contain a condyle, a curved process that fits into a fossa found on the articulating bone. Condylar joints are biaxial, allow for movement, however they cannot rotate. The mandible to temporal joint is a good example of a condylar joint. The mandible can move due to the condylar joint but cannot rotate. Pivot joint. It's a bone capable of spinning along its longitudinal axis, such as the joint between the first 2 vertebrae. This spinning allows you to shake your head as if to say no. The spinning can go in either direction. Cartilage. This is a stiff but flexible tissue that is good with weight bearing, which is why it is found in the joints. Cartilage has almost no blood vessels and is very bad at repairing itself. Bone is full of blood vessels and it's good at self-repair. It is the high water content that makes cartilage flexible. The muscles of the thigh and lower back work together to keep the hip stable. The muscles are responsible for the movement of the human body. They are attached to the bones of the skeletal system, and there are about 700 named muscles that make up roughly half of a person's body weight. Ligaments are fibrous connective tissue that attach bone to bone and usually serve to hold structures together to keep them stable. Skeletal muscles are long, thin, multinucleated fibers with striations attached to bones of the skeleton. Their function is locomotion and they are voluntary control. Cardiac muscles are a network of striated cells connected by intercalated disc with a single nucleus per cell. The location is the heart, the function is to pump blood, and the type of control is involuntary through the SA node. Smooth muscle. Spindle-shaped cells with single nucleus. The location is walls of the visceral hollow organs and walls of blood vessels and iris. Function is peristalsis and constriction, and the type of control is involuntary. So what does a decrease in height mean? A person is not as tall at the end of the day as they are at the beginning. That's because as the day goes on, water in the discs of the spine get compressed due to gravity, making the patient just a tiny bit shorter. But once they get a good night's rest, the body recovers and the next morning they're back to their height. Older people, though, shrink over time due to gravity, and the discs between the bones in the spine get compressed. The vertebrae end up pressing closer together, which makes a person lose a little height and become shorter. Older people can also shrink because of osteoporosis. An osteoporosis occurs when bone is broken down and not enough new bone material is made. Over time, bone is said to be lost because it's not being replaced. Bones become smaller and weaker and easily break if someone with osteoporosis is injured. So how does obesity affect the musculoskeletal system? Obesity accelerates the wear and tear on the joints and the spine. In particular, osteoarthritis, which is also known as the wear and tear arthritis, of the knees is increased. Obese people have difficulty squatting or getting on and off the toilet, getting out of a car, running, or climbing stairs. Obesity also affects spinal mechanics. Truncal obesity with a panniculus causes an anterior bending force and a compressive force on the spinal column, which leads to disc pathology and back pain. How to assess a Romberg test. A normal result of a Romberg test would be the patient displaying minimal swaying for up to 20 seconds. Some minor swaying may occur, but the swaying would not cause a loss of balance. The nurse should stand close to a patient to prevent falling. A positive Romberg test would indicate that the patient sways and is a sign of cerebellar dysfunction, as in cerebellar ataxia. In Figure A, this is abduction. Abduction is taking the body part away from the central line, and adduction is moving it towards. Circumduction is a combination of movements. It is possible at ball and socket, condyloid, and saddle joints such as the shoulder, hip, wrist, and ankle. It involves moving the entire connecting limb through its full range of motion. Range of motion is important in order to maintain flexibility. What medication would cause alarm in musculoskeletal problems? Some medications can be harmful to the bones. Bone loss is usually greater if they take them in high doses or for a long period of time, such as aluminum-containing antacids, anti-seizure medications such as Dilantin or phenobarbital, cancer chemotherapeutic agents, gonadotropin-releasing hormone, heparin, lithium, Depo-Provera, methotrexate, and proton pump inhibitors like Nexium, Prevacid, and Prilosec. What is an initial action when inspecting the musculoskeletal system? Always begin with inspection, palpation, and range of motion, regardless of the region examined, except for the abdomen, which is inspection, auscultation, percussion, palpation. Regional considerations is that remember that the clavicle is part of the shoulder, so be sure to include it in the exam. The patella is much easier to examine if the leg is extended and relaxed. Be sure to palpate over the spinous processes of each vertebra. It is always helpful to observe the patient standing and walking. Always consider referred pain from the neck or chest to the shoulder, from the back or pelvis to the hip, and from the hip to the knee. Pain with or limitation of rotation is often the first sign of hip disease. So looking at normal from abnormal findings. Every musculoskeletal system exam, whether it be general or joint specific, involves inspection of the musculature and joints to evaluate for swelling or deformity, range of motion testing, palpation of any joints that appear to be abnormal, strength testing, and sensory examination. The diagnostic studies of the musculoskeletal system, MRI, metal device such as pacemakers and prosthesis interfere with the accuracy of the image and can be displaced by a magnetic force generated by an MRI procedure. Positron emission tomography scan of the brain. The patient should hold off on caffeine-containing liquids and foods as the central nervous system is stimulated and may alter the test results. A brain scan. The patient may receive an injection of radioactive isotope for the test. There is a 2-hour delay in the test while the brain absorbs the isotope. Radionuclide brain scan. Patients may be worried about contaminating family members with radioactive material. Small amount of isotopes are used. And waste, such as urine, does not need to have special handling. Grading muscle strength. 0 shows no evidence of contractility or palpable contraction. Grade 1 shows a slightly contractility without joint motion. There's trace strength. Muscle contraction can be seen or palpated, but strength is insufficient to produce motion, even when gravity is eliminated. Grade 2, about 25% efficiency in achieving range of motion with gravity eliminated. This is poor strength. The muscle can move the joint it crosses through a full range of motion only if part is positioned so that the force of gravity is eliminated. Grade 3, 50% efficacy in achieving range of motion against gravity without resistance. This is fair strength. The muscle can move the joint it crosses through a full range of motion against gravity, but not against any additional resistance. Grade 4, 75% efficacy in achieving range of motion against gravity with slight resistance. This is good strength. The muscle can move the joint it crosses through a full range of motion against gravity and against moderate resistance applied by the examiner. Grade 5. This is normal, demonstrating a complete 100% range of motion against gravity with firm resistance. Ligaments connect bone to each other at the joint level. 2 ligaments in the knees are more prone to injury are the anterior cruciate and the medial collateral ligaments. When the anterior cruciate ligament is torn, a snap is felt. The knee gives way, swelling occurs, and stiffness and pain follow. Treatment can be non-surgical or surgical. Complete healing of knee ligaments after surgery can take 6 to 9 months. The collateral ligaments provide stability laterally and medial to the knee. Tearing produces acute onset of pain, point tenderness at the site of injury, joint instability, and inability to walk without assistance. The collateral ligaments connect the articular ends of the femur to the fibula and tibia and not to the patella. The ligaments of the patella are unaffected. Because other ligaments remain attached and there is no fracture, the length of the leg is unaffected. The anterior cruciate ligament is the most common ligament requiring reconstruction procedures. So applying ice for the first 24 to 48 hours after surgery will reduce pain and swelling. Elevate the leg above heart level as much as possible will also reduce pain and swelling. Elevate the leg after exercise and always at night with the knee above heart level. Taking medication as prescribed, and informing the patient to not drink alcohol when they take their pain medication. The pain medication should be given 30 minutes before any exercises. Eventually, the pain subsides, and Tylenol should control the pain. The rehabilitation program includes a physical therapist and will instruct on crutch ambulation, range of motion, and strengthening exercises. Continuing these exercises after surgery is important to maintain knee range of motion, reduce scar tissue, and strengthen weakened muscles. Tendons connect muscles to bone. The most common tendon rupture is the Achilles tendon. The Achilles tendon is the single strongest tendon in the human body. The primary function of the Achilles tendon is to transmit the power of the calf to the foot, resulting in the ability to move forward, jump, dance. If it has to do with any motion, then the Achilles tendon is part of that activity. Occasionally, the Achilles tendon loses the ability to keep up, and the tendon becomes inflamed, resulting in Achilles tendonitis. A traumatic rupture of the Achilles tendon occurs during activities where there is a sudden contraction of the muscle with the foot fixed firmly to the floor or ground. The patient will experience a sharp pain and cannot plantar flex the foot because the Achilles tendon is the plantar flexion for the ankle. Immediate surgical repair of complete Achilles tendon rupture is usually recommended to obtain satisfactory results. After surgery, a cast or brace is used to immobilize a joint. In some situations, conservative management with the plantar flex cast for 6 to 8 weeks may be used. After immobilization, a heel lift is worn and progressive physical therapy to promote ankle range of motion and strength. A dislocation is the displacement of bone that form a joint, and a joint is where two or more bones meet. In a dislocation, the surfaces of the bone that normally articulate with each other, they join together to allow movement, no longer line up correctly and none of the joint surfaces are touching. A subluxation is a partial dislocation, so some contact remains between the joint surfaces. The most common dislocations of the major joints involve the shoulder, patella, and elbow. The process of restoring the bones to their correct alignment is known as a reduction. First, the injury is almost always very painful until the dislocation is reduced. Second, the deformity produced by the dislocation may stretch, kink, or tear adjacent major blood vessels or nerves. This effect on the neurovascular structure may severely threaten the circulation or nerve function in the most distal part of the limb and may cause irreversible damage if not corrected in time. Complete dislocation, say like of the knee, and not just the kneecap, is especially dangerous. A different problem which particularly affects the hip is that part of the bone may receive its normal blood supply through the joint itself. When the joint dislocates, that part of the bone may lose its blood supply and become ischemic. Finally, hemorrhage and swelling progressively develop in the joint and the surrounding structures, so relocating the bones may become more difficult as time elapses. For all of these reasons, prompt reduction of a dislocation is important. After any manipulation, the nurse and the physician must recheck and document the neurovascular function in the limb. In almost all cases, the physician will request repeat X-ray studies in order to demonstrate that the reduction was successful. A strain is disruption of the contractile elements in muscle and or tendon. A sprain is an injury to ligaments and or the joint capsule that occurs in response to large stresses. An easy way to remember the difference between strain and sprain is that strain is spelled with the T, which can infer the associated word tendon. Both sprains and strains are due to increased demand or large stresses placed on the involved structures like ligaments, muscles, or tendons. In a mild sprain, the individual can usually engage in normal activities within 3 to 6 weeks. In a moderate sprain, Normal activities can usually resume in approximately 8 to 12 weeks. Ligamentous tissue requires approximately 8 to 10 weeks to heal. By the third or fourth week, the individual with moderate sprain will usually have normal range of motion and be free of pain. The key to recovery from a moderate strain is to prevent the patient from returning to normal activity before the ligament heals. Excessive stretching of a muscle or tendon when it is weak or unstable can be classified according to severity, first, second, or third degree strain. The management is the Rice principle: cold and heat applications, exercise, activity limitations, anti-inflammatory drugs, muscle relaxants, and possibly surgery. So rest, ice, compression, and elevation. The rotator cuff can be injured in many ways. Some people have rotator cuff problems as they get older, and this is caused by general wear and tear on the joint and aging. Some people have problems because of repeat motion such as overhead activities, throwing a ball, swinging a racket, or swimming. They can also have problems after a heavy force tears the tendons. Some examples of this are lifting a very heavy object or falling right on the shoulder joint. The rotator cuff has a low supply of blood. This means that when it's injured, damaged, or torn, it takes a long time for the pain to settle down. Surgery is needed when the rotator cuff causes severe pain, weakness, or the patient cannot move their shoulder. That is called a complete tear. A partial tear may also need surgery when treatments such as medication, steroid injection, and physiotherapy have not helped. Shoulder pain cannot initiate or maintain abduction of the arm at the shoulder. Conservative treatment, nonsteroidals, physical therapy, sling support, ice or heat applications during healing, and then a surgical repair for a complete tear.